Knock, knock, knock. Hello, my name is Heather. I'll be your nurse today. I'm going to wash my hands. I'm going to put on some gloves. I am going to check for tubing and oxygen. Everything is intact. I am going to check for ergonomics with the bed at the waist, which we're doing the best we can. Going to close the privacy curtain. And can I get your name?
All right.
Date of birth?
4/22/79.
Do you have any allergies? Do you know where we are?
Doctor's office.
Do you know who the president is?
Biden.
Do you know what today's date is?
October 29th.
Okay. Patient alert and oriented. Last coma scale 15. Pain from 0 to 10, 0 being no pain at all, 10 being the worst pain. Are you in any pain?
No.
Okay. I'm going to check your vitals, your blood pressure, your O2, your oxygen, your respiration, all within normal limits. I'm going to have you bring your fingers to me right here. Okay, checking for clubbing, no clubbing noted. Okay, I'm also going to check for cap refill. Cap refill 3 seconds or less. I'm going to have it check for turgid. No tinning noted. While I'm here, I'm going to use the back of my hands to check for the temperature. Temperature is normal. Color is normal for ethnicity. I'm going to check for pitted edema all the way down head to toe. No pitted edema noted. Okay, we are going to do your cranial nerves. Cranial nerve number 1, olfactory. I'm going to have you close your eyes for me. I'm going to ask you, could you tell me what you smell?
Vanilla.
Okay, vanilla. Cranial nerve number 1 intact. We're now going to do cranial nerves 2, 3, 4, and 6. We have the opticular motor, trochlear, and abducens. Okay, I am going to shut, you can open yours. I'm going to shut the light off, and I'm going to get my light, and I'm going to go from the ear to the eye, hand on nose to the bridge, ear to the eye. Okay, open the light, turn on the light. I am going to do 6 cardinal gazes. I'm going to have you keep your head still and follow me. 1, 3. Okay, and now I'm going to have you keep your eye on this and without moving your head, follow. Okay, Perlo is intact. Pupils are equal, round, reactive to light, and accommodate. We are now going to do, can you pull your eyes down for me so I can look inside that? Okay, sclerola is white, pink, conjunctiva is pink. I'm going to have you go with one nostril here, take a deep breath, and the other nostril, take a deep breath. Nose is symmetrical and patent. I am going to do cranial nerves number 9, 10, and 12. I'm going to have you open your eyes, or open your mouth. Okay, say ah, with my tongue depressed here. Okay, move your tongue straight. Okay, no deviations noted. Gag reflex present, uvula midline. Mouth is pink and moist. Teeth are symmetrical. Okay, cranial nerve number 5. I'm going to remove your hat. And close your eyes and tell me what you feel.
Forehead. Side cheek. Chin neck.
Okay, cranial nerve number 5 intact. Facial cranial nerve 7 is intact as well with the facial. I'm going to check the teeth. I'm going to check your head, symmetrical, no lice, no bugs, hairs evenly distributed amongst the body. Okay. Now I'm going to go behind you. And I want you to tell me what side I'm on.
Left. Right.
Okay, acoustics, cranial nerve number 8 intact. And then I'm going to have you shrug your shoulders. Okay, cranial nerve number 11, spinal accessory intact. Okay. We are now going to do pulses. We have your temporal. We have your carotid 1 and 1. While I'm here, I'm going to check your lymph nodes, ears to chin. Okay, we got your apical, which you will hear for 1 minute. We got your brachial. We have your radial and your ulnar. We have your femoral, your popliteal. We have from the toe to the middle of your foot, your dorsal medial, and then behind your ankle, we have your posterior tibial. Okay, I'm going to have you stand. And I'm going to look for any ostomies, distension, abrasions, rashes, redness. No, everything looks normal. I'm going to perform the Romberg test for balance. Okay, without letting me push you over, go ahead and, okay, I pushed you, no swaying. Okay, we're going to take 5 steps forward and 5 steps back. Here we go. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, and then I'm going to have you bring your arms up and out and up. Okay, patient able to perform flexion and extension. Okay, keep your arms this way. And I'm going to have you now push against me. Okay, and don't let me push against you. Okay, and with your hands, can you please squeeze as hard as you can? Patient able to range of motion and strength of 5. I'm also going to have you put your feet together and pull one leg out and in. Patient able to abduct and adduct. Okay. We're going to go ahead and now we're going to turn around and I'm going to have you grab your knees. Just bend down and hold your knees. Okay, we're going to go from the midline down for scoliosis. No scoliosis noted. While I'm here, I'm going to do a thoracic excursion. Okay, go ahead and stand up and take a deep breath. Okay, lungs are symmetrical. Thoracic excursion complete. Go ahead and take a seat. Okay, we are going to do cardiovascular. All right. I have on your right sternum border your aortic, right sternum border, second intercostal. This is where your interventricular is open and your semilunar is closed. A little bit over on the sternum border to the left, your left sternum border, second intercostal, we have your pulmonic, and this is where the dub to the lub is heard, the S2 is the loudest. Below that we have your Erb's point, which is the left sternum border, third intercostal. This is where heart murmurs are heard with the spell of your stethoscope. Below that we have your tricuspis, your fourth intercostal on your left sternum border, and this is where the interventricular is closed and the semilunar is open. We then have where your apical pulse would be, your mitral, and this is where the S1 is the loudest, the lub, the dub. Okay, we are going to do respiratory. We're going to go posterior, 1 through 10. Each breath of the 26 points, the patient will take a deep breath. So we're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I'm going to have you put your hands on your hips. And we have 11 and 12 and 13. We have 14, 15, 16, 17, 18, posterior. I'm sorry, no. 10 was in the back. Oh, I did 18 on the side, yes. Alrighty, and we have anterior. We have 19, 20, 21, 22, 23, 24, and then underneath 25 and 26. We have tracheal, which is going to be the high pitch. We have bronchial, which is posterior 1 through 6, anterior 19, 21 and 22. And then we have your brachial vascular, which is going to be moderately pitched. Let me say that. Tracheal, high pitch. Then we have your bronchial, which is 19 and 20. Then we have your bronchial vascular, which is 21 and 22 anteriorly, 1 through 6 posteriorly, moderately pitched. And anything below that is low pitch into vascular. Okay, I'm going to have you lay back. I am going to listen for sounds in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I am going to palpitate 3 times on each quadrant. Are you in any pain? Okay, no distension noted. And 5 to 30 is normal range, sound range. Anything below 5 is hypo, anything above 30 is hyper. If sounds are absent, each quadrant must be listened to for 5 minutes. I'm gonna have you straighten out your legs, checking for DVTs. Okay, I want you to put your toes to your nose, push on the pedal, toes to the nose. Patient is able to plantar flex, dorsal flex, plantar flex. No swelling, redness. Do you have any pain?
No.
No pain. Okay, you can sit up. No DVTs noted. Okay, I am going to can the patient their bedside table, their call light. I am going to remove my glove, wash my hands, make sure safety is complete. And head to toe assessment is complete. I hope.